We want to talk about the dangers of the smoke that's lingering in the air and something like a wildfire, because of course we know wildfires here in Arizona. We've got several of our own that we're still watching. It's an all too familiar sight, these pictures that you've been seeing right in Los Angeles, the heavy smoke blanketing the city and all the surrounding areas. Wildfire smoke, though, poses a significant health risk to people who live there, and that's because it's really a complex mixture of dangerous gases and fine particles. But understanding the risk and knowing the precautions you can take can, of course, help keep you safe. So that's why this morning we have Dr. Nina Shah. She is the Chief Medical Officer at HonorHealth and a pulmonologist, joining us with what we need to know. And Dr. Shah, thanks for being here this morning.
Thank you for having me.
We, of course, don't want to scare anyone. The goal here is just to keep you informed, ready and safe in case there was any type of fire emergency, because unfortunately, Arizona, we do have wildfires ourselves. Let's first talk about the smoke, something like this. How dangerous is it right now for the folks living in Los Angeles, and if we were to have one?
So for the folks living in Los Angeles, the wildfire smoke is pretty toxic, and especially for those people that are elderly, pregnant, have chronic conditions such as COPD or heart disease, the wildfire smoke is toxic. So unfortunately, wildfire smoke, when you breathe it in, can lodge deep into the recesses of the lung, can come into contact with the blood, go through the body, and we see things like increased rates of heart attacks and strokes when people are exposed to a lot of wildfire smoke.
And also, you know, the chemicals that the people are breathing in, because it's not just burning per se the trees and brush, right? There's a lot more involved in this.
Absolutely, and the chemicals cause a lot of inflammation in the body, again, as they come in contact with the various organs. So you can have things like asthma exacerbations, symptoms like wheezing, headaches, even things that you wouldn't necessarily think about as the toxins go through your body.
And is this something that could be long-term? Can it lead to worse health issues?
Absolutely. I mean, it does depend on the amount of exposure that your body has to those toxic smoke chemicals. But, you know, there are short-term and long-term effects, and people are still studying the long-term effects. But we know that a lot of exposure can lead to, again, organ damage and even premature death.
And we have seen, you know, some people wearing masks. Thank goodness that they have those. Probably something, you know, we probably don't think of an emergency plan, right? You have a fire in your home. But what are some of the things that we can do so that families are prepared in case there were to be a fire emergency?
Great question. If you have time to prepare, you really want to do things like make sure you have 7 to 10 days of medications on hand in case you were evacuated, for instance. You really want to stay indoors in the case of wildfires, if that's possible. Run your air conditioner, keep air purifiers on, and then having KN95 masks or an N95 mask available, not just for you, but for children and loved ones who may have chronic conditions is important as well.
And have those things just ready to go, with any kind of an evacuation plan, right?
Absolutely.
I haven't seen anything about the smoke coming from California just yet, but are folks probably thinking, hey, well, could that affect me here in Arizona eventually?
Well, certainly we want to pay attention to the air quality index, and so that's that number that you see, you know, on your iPhone or on the internet to tell you how healthy the air is around you. And so levels of 100 are considered pretty unhealthy for people that are sensitive. So again, those with chronic conditions. Above 200 is considered toxic for a lot of people.
Okay, and we, of course, our team of meteorologists are always keeping on track with that, keeping you in the know with anything that could be dangerous to your health. Thank you so much, Dr. Shah, for explaining that, and we appreciate your time this morning.
Thank you.